We know as more Coloradans get vaccinated, there will be more questions about vaccine safety. Tonight, we are answering questions for pregnant women. A woman in Florida who received her vaccine just gave birth to a baby who has antibodies for COVID. Denver 7's Addie Guajardo spoke with health experts to help you make an informed decision.
Nearly 100 days ago, the first COVID-19 shot was administered in the U.S. Since then, women have wondered how it could impact their pregnancy.
Let's talk about pregnancy
and fertility.
This was a very popular session.
The University of Washington School of Medicine hosted a webinar with a group of women health experts to shed light on growing concerns.
What are the potential side effects down the track, either breastfeeding or fertility-wise? Like, is it possible that this will impact my ability to get pregnant?
These are the questions Jada Campbell asked herself. The mother wants to expand her family in the future.
I hope to have at least 2 or 3. It's a debate with my husband.
Dr. Elisa Kachikis, a professor in maternal fetal medicine at the University of Washington, was part of the panel. She's aware of misinformation and hesitation.
There's really no reason to think that the vaccines would have an adverse reaction to the pregnancy or cause other side effects like infertility.
Data on the impacts of the vaccine on pregnancy is limited because trials typically exclude pregnant women.
You can look at the data, not having data both ways. You can say that there's no data to say that it's safe, but there's also no data to say that it's not safe. And we know that the vaccine has been very safe in non-pregnant people.
What we do know is that new studies are revealing glimpses of information. A recent Reuters article revealed Israeli researchers found antibodies in the newborns of 20 women who received the Pfizer vaccine through placenta transfer. In Florida, a woman who got the Moderna shot gave birth to a baby with COVID-19 antibodies. More studies are needed, but Dr. Kachiki says this is common with other vaccines given to pregnant women.
That antibody to the COVID-19 vaccine will cross over the placenta to the fetus and thereby protect the newborn for the first few months of life.
She says getting the shot can prevent serious health effects if the mother contracts COVID-19.
Pregnant people are at higher risk for adverse events with this infection, including needing to be admitted to the hospital, needing to be admitted to the ICU.
There's a lot of rumors out there that it could cause sterilization or the possibility of birth defects. Can you address those for us?
Yeah, those are rumors. There's really no evidence that points to that.
Jade weighed her options.
So I think it's important to weigh out the pros and cons.
After consulting friends and reading medical research on the vaccine, at the end of the day, everyone has a choice. And if you're not sure, experts recommend talking to your doctor.
So I'm currently registered to get it on Wednesday.
Addie Guajardo, Denver 7.